Hey guys, now that fall is coming around, a lot of our clients are coming in complaining about a variety of arthritis issues that are kind of rearing their ugly head as the weather is getting a little chilly and a little damp outside. So, arthritis can happen anywhere, but some of the common places that many of our patients are feeling it is the knee, the hip, their spine, their neck, TMJ, and even the ankle. And one of the things that we've been getting asked is whether PRP injections are something that they should consider. Now, PRP is something called Platelet Rich Plasma. And they basically take your own blood, they spin it out, and they separate the plasma and the platelets, and then they inject it back into the area where the tissue is damaged. And the idea is that if you add this back into your joints, it can stimulate tissue healing and repair because there are several growth factors in the PRP process that kind of stimulate healing. And as far as the most recent kind of comprehensive literature that I was able to find on PubMed through NIH is that actually PRP is helpful for knee, ankle, TMJ, and the hip. And it's helpful in the sense that it does help improve and show functional improvements. And it also helps pain. Although for those who have hip arthritis, pain didn't necessarily improve as much as with the ankle, the TMJ, as well as the knee. Now, the one thing that we find from a clinical standpoint in our practice is that when you combine PRP with physical therapy, and not just any physical therapy, but holistic physical therapy, where not only are you just working on that joint, but you're working on the whole body as far as why those imbalances occurred in the first place. So why is it that you ended up getting to the point where your knee became arthritic or your hip became arthritic? For many, it's the imbalances that developed around that. And of course, there's genetic factors that can play a role. But there are imbalances that were created around that joint that then certain parts of it started to wear down. And so if you attack those balances by finding why those occurred in the first place, and for some, it's not just around the hip, right? It could be the core, it could be further up, it could be down into the foot and ankle area. So if you address those all together, along with working on the soft tissue and the strength, and functional strength particularly, you can see a tremendous difference in people's function. So I hope for some of you who are kind of looking around for answers, I hope that helps. Have an awesome day.